163 million American adults wear glasses or contact lenses, but 11.5 million have vision conditions so severe that glasses don't help. We talked to researchers around the country who are setting their sights on saving sight for those who've lost it.
I'm a physician assistant. I was in the Navy doing, suturing and stuff like that. That's when I really noticed where I couldn't tie a knot. I couldn't see the end of the knot.
Rick Timmerman is in good company. He's among the 90 million Americans who've noticed a vision change in middle age. The medical term is presbyopia, an eye condition that makes it difficult to focus on objects close up.
And you can go ahead and lay back.
Clinical trials are now underway using a tiny implantable lens called AcuFocus to restore near vision.
All right, we're starting with the laser.
Using a laser, surgeons make a flap in the cornea. Then they place a donut-shaped lens, thinner than a human hair, under the flap.
That looks perfect. I like it.
The implant blocks unfocused light, while a small opening allows focused light to enter, improving what you see close up.
It's the first time that we're able to see beautifully at distance and at near out of the same eye.
I was helping a friend the other day in his garage, putting a cabinet together, and he's looking for screws. He wears glasses, and he couldn't find it, and I was like there it is. I picked one up, and there it is, so.
Russell DeLong had an even more severe vision problem. In fact, 4 years ago, driving a tractor would have been impossible.
I was totally blind. I couldn't see nothing.
Macular degeneration robbed Russell of his sight. Drugs and surgery didn't do much to help.
Everything looked like a real heavy fog.
I'm going to zoom in on your eye.
Then he found Dr. Susan Primo at Emory University. She uses this computer to map areas of the retina damaged by macular degeneration and those still intact. A specialized program then trains the patient to shift his or her vision using the good cells to see.
It's really a series of biofeedback training to get the patient to move in that position that we feel is going to be most sensitive to give him or her the best vision that is possible.
Russell uses these special glasses to help him read.
I can read this fine. If I look at it, it's blank. Nothing out there. I turn my head a little bit, I see around the scar tissue, and there the tractor is.
This is amazing. I didn't think I'd ever see again.
9 years ago, Kay Thornton was afflicted with a rare skin condition that severely damaged her cornea.
It's very frustrating because these patients are blind because their front part of the eye is scarred down.
Kay underwent a remarkable procedure called modified Osteo-odonto-keratoprosthesis.
A tooth out of my mouth. You're going to put it in my eye? And I said, yep.
Surgeons replaced Kay's damaged cornea with moist tissue from inside her mouth.
And then we take the tooth and the bone that communicates with that lining all the time in the mouth, and we put it in the eye.
The bone and tooth serve as the base for a prosthetic lens that works in Kay's eye like a telescope.
I could see it. Oh my God, I do see it.
As Kay's eye heals, doctors will implant a shell that will make it look more natural. Studies in Europe indicate the prosthetic lasts up to 10 years.
Run me on the board,
Promise I didn't do that on purpose.
From common to rare conditions, 3 new ways to restore the gift of sight.
It's nothing like you think. I thank God every day